Weird Wayne. He'll explain that one in a moment, but go ahead, maybe since he's going to be in charge of the keyboard thing. So let's welcome Wayne with a round of applause.
I had to connect something weird. I really don't think I'm weird. Maybe some other people might think something different. I got to shake my head a little bit to try and light those candles. This was a present from my two daughters when I turned age 60.
How long ago was that?
Almost 3 years ago.
I think your microphone's not quite on.
Is that better? Whoa. Whoa. That's a little bit loud, isn't it?
Yeah. By the way, we didn't need the hat for the slide, Wayne. You're good.
What's
We
that?
should have told them to run a tree to go
We didn't
with
need a
it.
hat for the weird Wayne thing. We're good without it.
Good without it.
We're all kind of weird here anyway.
Well, I'm talking about a serious topic today, but I suppose I should get rid of the hat. And this beginning is going to be quick. It's going to be intense, and some of it may not sound like Jesus, but there's a purpose behind doing it that way. In America, healthcare is built on a lot of myths, and the myths are perpetuated by a lot of the moneyed interests and special interests that make a profit off of the healing of others and the suffering of others. It influences our perceptions because the pretty picture in the center is marketing, and every company does it, and you never see a bad picture about healthcare. It's always somebody that's smiling. So it's always presenting a picture of perfect health. And what that does, that influences public policy, and it hides the reality of healthcare in America. Hence that one little word up there. The American way. We are the richest country in the world. And we are the stingiest on providing benefits for the poor and those that need help. We have the highest poverty rate, as seen on screen, in the industrialized world. That becomes one of the reasons, because other nations take care of the people needing help better than what we do in America. We're the only country, one of a few countries, that do not hold health care as a human right, a basic human right. Even third world countries, in their constitutions, many of them identify health care as a basic human right. Now, in many of those countries, they don't have the resources to be able to actualize that or make it happen, but they at least recognize in a third world country that health care is a basic human right. Not so in the United States. As a consequence, boy, I didn't think I was that weird.
You're bringing down the house, Wayne.
You just keep talking, man.
Okay, as a consequence, somebody dies every 12 to 30 minutes from lack of access to health care. And lack of access means lack of health insurance, adequate health insurance, affordable health insurance, or people that are underinsured. Institute of Medicine, which is a nonpartisan group, 2002 study, identified 18,000 deaths per year because of lack of access to health care. Harvard Medical School, in a later study, identified 45,000 people that die each year because of lack of access to health care. Now, I'm going to say that both of those studies are probably an undercount, because when you get into academic studies, they always make assumptions. And the assumptions on both of those studies, the population group included in there was age 19 to age 64. The assumption is, once you're 65, you have Medicare and you have adequate access to health care. Many seniors split bills, don't take the medications they're supposed to because they can't afford it. Is that adequate access to health care? 18 and under. The assumption is the children are on their parents' health insurance policy, or they are covered by the safety net that you hear about on soundbites through other children's programs like CHIP and SHIP. I'm going to put this in a different way of space bar. Oh, up there.
You hit the right click, that's one.
Different way of saying it. Last slide, 18,000 deaths, Institute of Medicine, 45,000 Harvard Medical School. In 9/11, there were 3,000 deaths in 1 year. So in comparison to 9/11, you would need to have a terrorist action against this country between 6 and 15 times a year to come up to the number of deaths that you have in this country from lack of access to health care. Afghan war. When I got this statistic, it was earlier this year. Afghan war has been 3,000 deaths. These are round numbers. The war was going on at 10 years. That's 300 per year. Oh, I'm going the wrong way. That means you'd have to have that war starting 60 to 150 times per month to come up to the same death toll that you have from lack of access to health care. Now, a couple of weeks ago, we had a video by Rob Bell, and he was describing the American, and it's laudable work, the American mission field in treating HIV/AIDS in Africa. But one comment caught my ear when he was talking about the death toll in Africa. And he said, that could not happen in America. That would not happen in America. And I would challenge that comment because I'm saying, and statistics show, that it is happening in America, but it may not be to the extent of the HIV crisis in Africa, but it is happening here. And another comment that Rob Bell made on another video was, what you look for, you will find. What you look for, you will find. Now, we have all those deaths. United States spends the most in the world. Almost $8,000 per person in America that spends on health care. You would think that we would rate number one in the world on what happens to us from the treatment from health care. But a 2002 World Health Organization study places us at 37th. We're the highest in spending. We're 37th in the world on outcomes. On infant mortality, you can read this stuff there. We're rated 33rd with Fiji. We have two more deaths per thousand births than the average in the world. There was an article in the newspaper several weeks ago in the Milwaukee Journal. Milwaukee County, or I don't know if it's Milwaukee County or City of Milwaukee, is between 10 and 11. Almost a double of what the world average is. The technical term for these preventable deaths is amenable mortality. And this is from a CommonwealthFund.org scorecard. They started this scorecard in 2006, which rates the United States against other countries in healthcare outcome. It's a very excellent website. Now I forgot where I was going. Oh well, I'll just jump on. 96 preventable deaths per 100,000. The top 3 countries only have 57. We have 40 more preventable deaths, spending the most in the world. The most in the world. Think about it. We spend the most, and we're that far down the ladder. And we have that many more people dying, that many more people, families suffering. You think of the suffering of the loved ones of those people that die. Health insurance. One of the perverse things that we have in this country is that health insurance is tied to employment. We stand alone in the world on employer-based health insurance. So, a few years ago, we had to come up with something called FMLA, which is Family Medical Leave Act. Because if you get injured on the job, you're somewhat taken care of, except that my son-in-law was on workman's comp, and he had to show up at the job when he was on light duty. The day that the company doctor cleared him for full duty, they laid him off. Laid him off, not fired. There's some fine points on how you do that as an when you do that as an employer. If you are injured off of the job, if you develop cancer, if you develop some kind of a sickness in which you have to be off from work more than 12 weeks, for that period of time during that 12 weeks, your employer is required to keep your job open, number one. Number two, they're required to keep you on their employer-sponsored health insurance plan. At the end of that 12 weeks, you better be ready to go back to work, because at that point in time, your only option is COBRA, electing COBRA, which will continue your health insurance. But that comes at a price. For my daughter's insurance, she paid a little bit less than $300 a month for family coverage, and I said less than. COBRA election for family coverage is over $1,000 a month. For her coverage alone is $487 a month. So COBRA for many people is not a viable option. Badger Care in Wisconsin has a waiting list. That's one of the safety net things that some people say that the poor have to support them so that I can't get into politics. That's okay.
You're talking faith.
Yeah. I just lost that train of thought. Well, that's fine. The screen came on. The other thing in this country, we are the only industrialized nation that does not provide 50 paid leave for 50 days of cancer treatment. The only industrialized nation that does not provide paid medical leave for a 50-day cancer treatment. So we also rank a little bit lower in what I call aftercare. And some of you might like this next picture. This is on maternity leave. And on the left-hand side, you see the United States at 0 weeks for paid maternity leave. Can everybody read the names of those countries around there? Okay, you got Pakistan at 12 weeks. Then you jump up to South Africa, Mexico, Japan, Germany, and now I'm having trouble reading them. Netherlands, Spain, France, Venezuela, Denmark, Britain or the United Kingdom, Italy, Norway, and Canada comes in at 50 weeks of paid maternity leave. Boy, that Canadian healthcare system is really bad. So, Kurt, it's up to you. It's time for a little breather.